Psychosomatic health refers to the intricate connection between the mind, psyche, and the body, soma, where psychological factors such as thoughts, emotions, and stress can influence physical health. Psychosomatic health acknowledges the bidirectional relationship between mental and physical well-being. Here are examples that illustrate the concept of psychosomatic health. 1. Stress and digestive issues. Example: chronic stress, whether related to work, relationships, or other life events, can contribute to digestive problems such as irritable bowel syndrome, IBS, or indigestion. The gastrointestinal system is highly responsive to emotional states, and stress can manifest as physical symptoms in the digestive tract. 2. Anxiety and cardiovascular health. Example: persistent anxiety and high levels of stress can contribute to cardiovascular issues. Individuals with chronic anxiety may experience an increased risk of hypertension, heart palpitations, and other cardiovascular problems. The body's stress response can impact blood pressure and heart rate. 3. Depression and immune function. Example: long-term depression may have an impact on the immune system. People experiencing chronic depression may be more susceptible to infections and illnesses due to a weakened immune response. Conversely, maintaining good mental health can positively influence immune function. 4. Chronic pain and emotional distress. Example: chronic pain conditions, such as fibromyalgia or chronic back pain, are often influenced by psychological factors. Emotional distress, including anxiety or depression, can exacerbate the perception of pain and impact the individual's ability to cope with or manage the pain. 5. Psychological factors in autoimmune disorders. Example: some autoimmune disorders, where the immune system mistakenly attacks the body's own tissues, may have connections to psychological factors. Stress, trauma, or chronic emotional distress could potentially contribute to the onset or exacerbation of autoimmune conditions. 6. Mind-body interventions for chronic illness. Example: mind-body interventions, such as mindfulness meditation or cognitive behavioral therapy, can play a role in managing chronic illnesses. These interventions may help reduce stress, improve coping mechanisms, and positively influence the course of physical health conditions. 7. Psychosocial factors in cancer outcomes. Example: psychosocial factors, including a patient's mental attitude, coping skills, and social support, can influence cancer outcomes. Positive psychosocial elements may contribute to better treatment, adherence, and improved overall well-being during cancer treatment. 8. Sleep and mental health. Example: disturbed sleep patterns, whether due to insomnia or other sleep disorders, can have a profound impact on mental health. Sleep deprivation is linked to increased stress, anxiety, and depression, illustrating the bidirectional nature of the mind-body connection. 9. Placebo and nocebo effects. Example: the placebo effect demonstrates the influence of psychological factors on physical health. Individuals may experience symptom relief or improvement in response to a treatment that has no therapeutic effect. Conversely, the nocebo effect occurs when negative expectations contribute to the experience of adverse symptoms or side effects. 10. Post-traumatic stress disorder, PTSD, and physical health, Python. Copy code. Example: individuals with PTSD may experience a range of physical health issues. The chronic stress and hyperarousal associated with PTSD can contribute to conditions such as cardiovascular problems, digestive issues, and an increased risk of chronic diseases. Understanding the interplay between psychological and physical health is crucial for holistic health care. Psychosomatic health emphasizes the importance of addressing both mental and physical aspects to promote overall well-being and effective treatment strategies. Integrative approaches that consider the mind-body connection are increasingly recognized in various fields of medicine and healthcare. Psychosomatic health, all in your head, leads to health or disease. The phrase all in your head is often used colloquially to suggest that certain health issues or symptoms are primarily or solely related to psychological factors rather than physiological ones. While this expression can carry a dismissive connotation, it is essential to understand the complex and interconnected nature of psychosomatic health. All in your head and psychosomatic health. Positive influence. Health, positive psychological factors, such as a strong sense of well-being, optimism, and effective stress management, can contribute to overall health and well-being. Practices like mindfulness, meditation, and a positive mindset can positively impact physical health. Negative influence, disease. Conversely, chronic stress, unresolved emotional issues, or mental health conditions can contribute to the development or exacerbation of certain diseases. Conditions such as cardiovascular issues, gastrointestinal problems, and autoimmune disorders may be influenced by psychosocial factors. Mechanisms of influence. Stress response. Positive influence. Effective stress management and coping mechanisms can mitigate the negative impact of the stress response on the body. Practices that promote relaxation, such as meditation and deep breathing, can positively influence physiological functions. Negative influence. Chronic stress, often associated with unresolved psychological issues, can lead to sustained activation of the stress response. This chronic activation is linked to a range of health problems, including cardiovascular issues, immune system suppression, and gastrointestinal disturbances. Immune system function. Positive influence, positive emotions, social support, and a generally optimistic outlook can enhance immune system function, supporting the body's ability to fight off infections and diseases. Negative influence, chronic negative emotions, such as chronic stress, depression, or anxiety, can weaken the immune system, making individuals more susceptible to illnesses and infections. Neurotransmitters and hormones. Positive influence, positive emotions, and mental well-being are associated with the release of neurotransmitters like serotonin and endorphins, contributing to a positive mood and overall sense of happiness. Negative influence. Chronic negative emotions can lead to imbalances in neurotransmitters and hormones, potentially contributing to mood disorders, sleep disturbances, and other health issues. Holistic healthcare perspective, mind-body connection. Positive influence. Recognizing the mind-body connection allows for holistic healthcare approaches that address both psychological and physiological aspects. Integrative practices, including mind-body interventions, can contribute to overall well-being. Negative influence, dismissing symptoms as merely in your head without considering the potential psychosomatic factors, may overlook important aspects of an individual's health and hinder effective treatment. Individual variability. Positive influence. Individuals vary in their responses to stress, emotions, and psychological factors. Some may exhibit resilience and maintain good health despite challenges, while others may be more susceptible to psychosomatic influences. Negative influence. Ignoring the psychosocial context of an individual's health can lead to a narrow understanding of their well-being. The dismissal of symptoms as purely psychological without a thorough assessment may result in inadequate care. Health and disease examples. Positive influence. Health. A positive mindset, effective stress management, and healthy coping strategies can contribute to overall health and longevity. Practices such as regular exercise, a balanced diet, and a supportive social network positively impact physical well-being. Negative influence, disease, chronic stress, untreated mental health conditions, or unresolved emotional trauma can contribute to the development of various health issues, including cardiovascular diseases, gastrointestinal disorders, and conditions linked to immune system dysfunction. Importance of a comprehensive approach. Integrated healthcare. Effective healthcare considers both the psychological and physiological aspects of an individual's health. A comprehensive approach involves collaboration between mental health professionals and healthcare providers to address the multidimensional nature of well-being. Patient-centered care. Acknowledging psychosomatic influences in healthcare requires a patient-centered approach that considers the unique experiences, perspectives, and needs of individuals. In summary, the notion of all in your head highlights the powerful influence of psychological factors on health. It is crucial to recognize and address the interconnectedness of mental and physical well-being for a comprehensive and holistic approach to healthcare. Dismissing symptoms without considering the psychosomatic aspects may overlook important contributors to an individual's overall health and hinder effective treatment.